Hey guys, welcome back to Embracing the Shift. I'm Erin and I have my girl, Stacy.
Hi.
Hi. Today's episode I'm super excited about because I have known this person for, dare I say, 13 years.
A long
time. So today we have on the show Austin Dennard, who is from Dallas. She is a doctor, but she is going to talk about, ladies, get excited,
Dun, 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 dun. Dun, dun, dun.
perimenopause, menopause, and hormone replacement. I feel like we need this. So with, what is it called? No further. How do they say
Without further ado.
Without further ado.
Austin
Dennard.
Yes.
Yay. Hi, Austin.
Oh my gosh. I'm so honored to be talking with you guys.
Oh, we're so excited.
We're so excited. We have so many questions.
You have no idea.
I hope you can answer all of them.
Here we are. We have all the time in the world.
Yeah. I love it. Tell us a little bit about yourself, first of all.
So Dr. Austin Dennard, but you can call me Austin. Obviously, we've known each other
I knew her in college
life.
Guys. Yeah.
Yes. I'm a board certified OB-GYN. As you guys know, I'm a mom of 3 and I practice here in Dallas. I still do it all. I do OB, I deliver babies, I delivered tons last night, and I do GYN surgery minimally invasively. And now a much bigger part of my practice is perimenopause and menopause.
Mm-hmm.
Yeah.
I'm loving your TikTok, by the way.
Oh my gosh.
It's
so
like
cringe.
She just all of a sudden it's popping up all the time on my For You page. And I'm like, well, there she is again. And let me see what happened at work tonight. Let me see what happened at work this afternoon.
How many babies have you delivered?
Do you even know?
Oh my gosh. Thousands and thousands and thousands.
Which that could be a whole other episode of like,
yes. I'm like, this could go so many directions.
So many directions. But we're going to keep it focused in today because while she could talk to us all day about babies, and there's probably a lot of women that would love to hear all the stories and all the things about OB-GYN. Yeah, because that's an important topic too. But we really wanted to hone in because Austin and I get to talk when I see her, not as often as I would like to, but for different things because we've become friends throughout the years where, we're texting about this and that all the time. But hormones have become such a hot topic. And I know I remember one time you were in my office and you were like, I literally have a stack of books on my nightstand and it's all about menopause because you're getting like thrown all these questions at work all day and you're like, we got to start talking about this.
Totally.
So I think just starting off the conversation with like, what is perimenopause / how long are you in it? What's menopause? Like the basics.
If you were to Google perimenopause and menopause, even menopause.
Well, it's fascinating because I don't even think people really were talking about perimenopause even a couple of years ago.
No.
It was like, are you in menopause or are you not in menopause? But now the conversation is much more robust and there's a lot of new studies and we're reviewing it and it's really kind of in the forefront. I think it's a combination of that and where we are in our lives. That we're probably, the algorithm is starting to feed us more information. Yeah. But to answer your question, perimenopause, oh my gosh, what is it not? It's not menopause. Menopause is when our ovaries have completely finished functioning. And if you have a uterus, you're not having periods anymore. By definition, menopause is no periods for a year. But that's kind of a tricky definition for a lot of people because some people have had a hysterectomy. They don't have a uterus anymore. They've had an ablation procedure, so they don't have a period from that. Or they have a hormonally secreting IUD. And so oftentimes they're coming to my office and going, I don't even really know if I'm in menopause. Like, did I already go through perimenopause? What is perimenopause? So what I describe perimenopause is more of this kind of hormonal, chaotic time before you get to menopause.
Chaotic's such a great word.
It's chaotic. It's like puberty in reverse. And it's as our ovaries are losing eggs and losing follicles and the quality of those eggs and follicles are starting to decline.
Okay.
We're not producing as much estrogen consistently. So then what happens if the ovary is not producing as much estrogen, the brain starts going, wait a second, we don't have as much estrogen as we have had in years past. Make more estrogen, ovaries, make more estrogen. And so then you'll have your estrogen levels like shoot up the next month. And
so they can be low and then go high.
It is chaotic. I always tell my patients, it's like you get your 3 children and you give them different color markers and you have them color on the wall. And that is a graph of the level of estrogen, testosterone, and progesterone when you're in perimenopause.
Wow. So is this why, because you and I talked about this, is this why drawing labs is kind of like a moot point? Because it's like, it can be different daily. It's different month to month. So gauging labs is not most helpful.
Labs are not really helpful. Now, they're good to rule out kind of zebras and more rare things like super abnormal thyroid levels or a prolactinoma, like a benign tumor that's growing in your brain and things like that. Right. But as far as diagnosing perimenopause, labs are kind of garbage. And so what I see happen oftentimes is women will not feel like themselves. They'll go to their doctor. They'll say, I think it's something with my hormones. Their doctor will say, they'll kind of roll their eyes and go, okay, I guess I'll order these hormones for you. And then they come back and they go, oh, all normal. You're good. And that is the beginning of the gaslighting that we all experience in midlife, that those of us in the menopause and perimenopause space are trying so desperately to reverse and start informing people of what this is. You're not crazy. These symptoms are not out of nowhere. They are very much a manifestation of the crazy chaotic levels of your hormones during this sometimes like a decade-long time before you get to menopause.
Well, I was talking to someone, or maybe I was even saying this at home last night. I can't remember, but I just had this conversation where I was like, my heart, like actually now that I'm in this phase of life where like I do feel like I'm starting to probably walk through that perimenopause phase. My poor like mom and grandma and these women that went through this before us, but especially, well, I guess my mom too. I mean, my mom too. Anybody in their late 50s and older, like you literally at moments can feel like I'm going to lose my mind. I have no control. And people just thought they were crazy. I think for sure back in like the 1950s, 60s, 70s, like women were literally like,
they were hysterical. Like they were crazy.
They were known as being crazy.
Yes.
And now we're looking at it going, oh, there's so much more to it. And they had to walk through that with no one caring at all to look into it further.
It's crazy. I mean, we look back at the history of midlife care, menopause care, hormone replacement therapy, and there is this major cataclysmal event in women's health, and it was the Women's Health Initiative study in the late 90s, early 2000s that unfairly and preemptively came out with the media saying like, estrogen, progesterone, it all causes breast cancer. So what happened was the lucky boomers, right, who were already on their estrogen, progesterone from their, frankly, old man gynecologists, because most of the gynecologists from that decade were all men. If they were lucky enough to not have it ripped out of their hands, they were able to continue. But the now younger boomers and entire Gen X was never given the opportunity to even start the conversation. And so it's just now the tide is hopefully turning. The FDA just approved removing the black box warning off of estrogen, which is like a huge deal. But yeah, I mean, my younger boomers and my Gen Xers they come in and they're pissed.
Yeah.
They are on social media. They are reading books and they're going like,
wait a second.
Yeah. And especially the ones that have been through menopause and it's been more than 10 years since their last period. They're often asking me like, is it even worth me getting on estrogen at this point? Am I going to be able to improve my bone health, improve my cardiovascular health, and improve my, reduce my risk of dementia if it's been this long?
Is it one of those things where it's never too late? Or is there a point in time where it's like, you know what? It's not really going to serve a purpose.
I think we need to do more studies. Yeah. It's still a little bit of a question mark. And that's when shared decision-making and having a conversation with a really knowledgeable provider is super important because you might feel like, you know what, I want to try it. I want to see how it goes, even if it doesn't move the needle much. And there's still women that are having symptoms of menopause 10 years out that really don't want to have hot flashes once a day.
Yes. Like that's or the number one I feel like that you hear about is hot flashes.
Is there, is there a specific age range you can say, hey, between these ages, this is, can you look at a graph and say between these ages, perimenopause, between these ages, menopause?
Or is it symptom-based?
Right.
It's symptom-based. I will have some patients as young as their late 30s starting to have perimenopausal symptoms. And it's a range, right? And I always look through the lens of like, it's hormones until proven otherwise. Right. The problem is that your average 42-year-old comes into your office. She is on a beta blocker because she has heart palpitations. She is on a sleep aid because she's been sleeping like absolute garbage for 2 years. She is on an antidepressant because she doesn't feel like herself and has gone to see a psychiatrist. She might have even gone to a rheumatologist because she feels like she maybe has an autoimmune disease. And they come in on all these medications. And not to say that some people do have heart palpitations. Some people do have anxiety, depression that needs to be treated. But the commonality is like,
is this hormone related?
This hormone. And so they've had this $1 million workup with their cardiologist. Oh, everything's fine. You just have palpitations. Or, oh, you're sleeping like crap. Here's Ambien. When the root of the cause is just these like erratic changes in hormones.
What's the Band-Aid, right?
Exactly.
We're just and I feel like we've kind of been wired for decades to Band-Aid problems instead of look at the root, which goes into a whole nother, we won't even get into that, but all the stuff that I was talking to, Austin and I know a pharmacist that is real into like, she's very open to like brain work and nervous system stuff. And it's so interesting to me because when we heal our bodies from the inside, instead of just masking the problem with a different medication, not that medications are bad because they're necessary in a lot of areas, but they're also unnecessary in a lot of areas when we're trying to just find a quick fix instead of, hey, let's look at why this is actually happening, which is I think what we're finally doing for women is like, okay, why? Are all these women experiencing the same thing?
We're all experiencing it. And what more of a natural approach to fixing the root of the problem than giving yourself back the natural hormones that your body has literally been producing ever since you started your period. Rather than, these other options. Now, I think mental health is a huge part of this. Having our counselors, having our therapists, like we need all of these extra helpers because menopause and perimenopause is often happening at the time in your life where there's a lot going on. I mean, the fact that the three of us are even sitting here right now is kind of crazy.
And if you own businesses or you work full time or you have kids, and I not to discount kids being younger because we've all been through that and you're still in it.
Yeah.
But we had an episode where was this our first episode? I said something about like, you have all this support when you have younger kids or you're having a baby. Like people are like, how can I help? Can I babysit?
Can I be a counselor?
And then I'm over here with this teenager and people are like,
running away.
Stay away. You have preteens and teenagers and it's like, you don't get the support. So you're also feeling very alone in this phase of life. And you have kids going through their own hormonal shifts, which is just impacting your hormones.
You're going through puberty in reverse.
How many times
going through puberty?
How many times will I tell you something and I'm like, I think this is wrong. This was from the sun or this was from the wind or something I ate. And Erin's like, Stacy, it's stress. There's so many times I'll come to you with thinking it's because I want to diagnose it with something.
We want that quick answer.
Right.
Yeah. So speaking of symptoms, for people listening, like because I know ages is going to vary from person to person. So like, what are some things if a woman came to you and you're like, this person is probably for sure perimenopausal. Like what is she experiencing?
So it's interesting. There's so many commonalities, but then also it's really individualized. So I had someone the other day that was like, Dr. Dennard, I don't know what it is, but I literally cannot wear turtlenecks or wear the earrings that I used to wear.
A girl came in yesterday and said, Erin,
it's like
people can't touch my skin. She goes, I want all the things done to my face, but I'm going to tell you right now, I need Pronox because I can't stand the idea of you touching my skin. And I'm like, she goes, I've never been like that before. What's wrong with me? Yeah. So this is, sorry, that first one out the gate, I'm like, oh my God.
It's a thing. And so, itchy ears, dry scalp, skin changes, which of course you see all day long.
I literally, right before you walked in, was talking about my skin.
Yeah, I mean, just everything. You just feel itchy, how is all the moisture sucked out of my body? Vaginal dryness. And then you have palpitations, trouble sleeping, anxiety. You're just perseverating before bed. Like, I can't turn my brain off. I can't go to sleep. I can't stay asleep. And then you have brain fog because you slept like crap and your brain just isn't firing. And at the same time, we are at the top of our careers. We are being pulled in a million different directions. We're forgetting about, we're forgetting the names of our children's teachers. We're, it's like,
I forget when I'm in my bedroom, I'll be like, oh, I need to go get this out of the kitchen. And I'll walk to the kitchen and then I look around and I'm like,
why did I come here?
Why did I come in the kitchen? And so then I'll backtrack and I'll go back to I'm hoping that it prompts some sort of memory.
I hope whoever's listening feels really seen right now because I feel really seen because I literally I could not remember one of my kids' teachers the other day. And I was like, what is wrong with me? And so if you're listening to this,
well, that's why we're doing this, right? Like, I feel like this is the conversation.
Correct. And it was my husband the other day was like, how did you forget to put this on the calendar? Because like you said, we're managing businesses and we have these big stressors that we're taking care of and we can do these big things and then something will happen. I'm like, I swear I'm not crazy. This was not intentional.
It does make you feel crazy.
And when you're you start questioning, like, am I losing my mind? Or then you just feel guilty. I'm like, am I not leading well? And it's just our bodies.
It's our bodies. And,
it's our bodies.
And let me tell you, nothing will get a woman to the doctor faster than thinking they have like early onset Alzheimer's.
So that runs in our family
dementia.
And I'm very scared.
No, I've actually said I think I have it.
Yeah.
But dementia runs in our family and I'm scared to death.
Correct. So, I mean, this is more than, honestly, almost more than getting breast cancer. Women are so universally terrified of dementia. We do not want to be those old, frail ladies in the nursing home that have like just kind of lost their minds. I mean, that's like, we've seen the probably grandmothers in those states. And none of us want that. And so when you start having this brain fog and you feel like, I don't feel normal in my body, things are not firing the way that they should, I'm forgetting words at presentations, it's terrifying. And it will get someone to the doctor so quickly. So much more than just
So is that one of the, I mean, as I know we'll shift into like hormone therapy and what you are working on and people are researching. I guess, as I'm hearing this, I'm like, yes,
brain fog is a symptom of hormones.
It's a huge symptom of hormones. Yeah, it really is.
So the sleeping part, are there the brain fog, the sleeping, because I know those are probably some of the most popular ones, the anxiety. Is that kind of what you go off of when you're helping women get on hormone therapy? Do you guys go off of symptoms and then are the symptoms better? Are they the same? Are they worse? Is that kind of how you gauge like what to put them on?
Yes. So this is why going to see a provider who really knows what they're doing is important because, and don't get me wrong, I think it's fantastic that we have companies like MIDI who are doing large scale telemedicine approaches to really get access to care. But it can, not all of us are just like, my estrogen is low. My progesterone is low. I need a little bit of estradiol and a little bit of permetrium. Like it's not always that simple. And so if you have someone who's really listening to your symptoms and can kind of parse out what might be more of an estrogen deprivation related symptom versus progesterone, that's a really good way to start.
Well, I think we have to be really careful diving into who you see because it is such a new, I think there's a lot of OB-GYNs that are trying to learn it and learn it quickly. But it's like, this is going to be a specialty that people go to school just to treat perimenopause and menopause in years to come. So it is a massive subject to learn and to educate yourself on. So someone can't do that overnight. And do you feel like we're still learning so much about how, I mean, it's so new, our dive into this education process with hormone therapy. So it's kind of the Wild West still like it is with peptides or like other things.
It's medicine moving quickly, but also we're playing catch up in the medical community because none of us learned about menopause and perimenopause care. I mean, I went to med school way after the Women's Health Initiative came out. I mean, when Women's Health Initiative came out, I was still in high school. And so you think about this entire generation or two of physicians who I mean, we learned nothing. It was delivering babies and operating on people and dealing with some gynecology stuff. But really, there was maybe 1 or 2 lectures about midlife in general. And, so we have to re-educate. And that's for all doctors, not just OB-GYN. So the cardiologist needs to know that perimenopause is a thing. The rheumatologist needs to know.
The psychiatrist.
Needs to know, right? And it's not just the weight of it should not just be for the OB-GYNs to it's not our cross to bear. We are all taking care of women. There are 80 million midlife women and walking around. So we got to get.
Specifically with as we're talking about hormone levels, are there certain questions that you'd recommend asking your OB just in terms of making sure you're on the right page, the same page, I guess, is there, you know what I mean?
About how to suss out who has done their research and who hasn't. I mean, I think the first thing to do is to contact your current OB or your primary care, whether it's through, the HIPAA messaging system or just calling their front desk to be like, hey, does this person specialize in hormone replacement therapy? Or am I going to need to see somebody else? Because there are many doctors in my field that are like, no, that's just not, that's not my lane. And I will say, I am so passionate about this subject and I've taken so much extra time to learn as much as I possibly can. It is very, very hard to do good midlife care with a 15-minute visit. Yeah. In fact, it's actually kind of impossible. So now those of us who take insurance are in this crossroads of wanting to give the right care, wanting to listen, wanting to follow up appropriately. But insurance companies are like, yeah, well, that was a 15-minute visit and we're not gonna really reimburse for that too. So there's a lot of advocacy that still needs to happen.
Yeah. So going back to symptoms, because I'm gonna backtrack just a little bit. So sleep, obviously, anxiety, weight changes.
This is
belly?
The
What's
universal.
Belly? Is it belly weight?
When someone goes like this, that's the universal sign of perimenopause or menopause, because everyone tells me I'm doing exactly what I did in my 20s and 30s, if not more. I am counting my carbs, I'm doing my macros, I'm doing this and that, and it's just not coming off, or I just feel differently. And I promise I'm not vain. I promise it's not that. And all of us want to look good. All of us want to feel good. But what happens as your hormones change, estrogen and progesterone are very anti-inflammatory, and you start to really change the levels of those hormones, you have increased inflammation. And it also affects the way that your body is producing insulin and reducing your glucose levels. So
I was like, enter GLP-1.
Enter GLP-1. We could talk so long about GLP-1.
I know. This is definitely a multiple part podcast. But
it is a very exciting time to be doing perimenopause.
Oh, I'm so
with
thankful.
All the peptides too.
I feel like I when we were talking to that pharmacist yesterday, I was like, I feel like so grateful, but at the same time, it made me really sad for people before me that didn't have these opportunities. It makes me excited for my daughter to go through her walk and be able to have these resources and have so much more education in this department, because I think it's going to change women's lives. But another symptom, I'm going to go back again. Periods. So heavy, not heavy, here, not here, consistent. Because I feel like mine are actually the most, not TMI, but they're the most regular they've ever been.
Great. You must have a really good doctor.
But I do know it's
mine are not.
But when I say regular, I mean regular in the sense of timing, not so regular in
flow.
Yes.
So is that something that is significant?
Yes, hugely significant. So you can go, so the uterus is responding to the hormone levels, right? So the estrogen that is secreted from the ovary after your brain has told the ovary, okay, you need to build a follicle and release an egg. At the same point in time, the brain is telling the uterus, like, okay, time to build that lining because she's going to ovulate, and we want to make sure that the lining is nice and fluffy to house a potential pregnancy. Well, in perimenopause, the ovary is like, oh my God, I'm really looking for those follicles. I can't really find it. Oh my gosh, they're like old and they're dusty and there's like legit cobwebs, but the brain's really yelling at me, so I'm going to try real hard. And then sometimes you're releasing.
No, I have a visual, and it's
so
just
old
like
it's like get the Dyson out because it's just ovulating like crappy, like little dust balls, like hocus pocus level. And so the uterus is like
trying so hard.
Trying to do, and essentially what happens is it becomes very chaotic, and the lining of the uterus can be thicker and it can bleed more, or maybe you don't ovulate that month. And so you skip a month of bleeding. And then the next month you're like, whoa, this was a disaster. Yeah. I did not coordinate my outfit for the amount of bleeding. And so a lot of people will describe it as like bleed till you drop, because the number one reason why people are coming into their gynecologist, besides thinking that they might be, having early onset dementia, is that they're all of a sudden soaking through tampons and pads, and it might be a shorter duration. Their periods are getting closer and closer together, but the amount of bleeding is like wild. Insane. Like patients will say, "This is like what it was like in high school before things really got regulated."
That's a very familiar experience.
Last week I was like, I'm going to faint for the amount of loss that was happening.
No, I'm like, so I operate. Surely I'm going to die at any point.
Surely I've lost everything.
So I have one ovary, and I'm like, I operate off one ovary. So my other one's like really working hard. And so for the this year, I've noticed a difference, which means I'm probably the candidate for perimenopause.
You are. But
I've noticed it this year. But I've always been like, oh, maybe it's just that I'm down an ovary. Me and my excuses trying to find an answer.
She's the eternal optimist, where she's like, guys, I really feel, and like there's always
there's always something. I think it was just the wind.
I think it was just an off month.
She said my eyes are wind chapped. I said, no, honey, that is like full blown stress.
Estradiol cream that needs to go.
Just over here with my wind stress in one ovary, just like trucking along. So that's not the case. So I'm probably an ideal candidate. Great.
Okay. Yeah. Which is not, you're going, this is the thing,
we're all going through it.
Is these conversations
should be normal.
Should be normalized, and we should be having them all the time, because if there's one thing that we can all relate to, it is the hormonal changes that happen in a woman at a certain age. And when she's done not done having kids, but like, when her body's kind of entering that next phase, it's all the same across the board, or it wouldn't be such a hot topic if we weren't all experiencing it.
Yes. And honestly, when you're in the bathroom experiencing that, where you're like, oh my gosh, what happened and the flow and what is wrong with me? I'm going to die. Even just hearing that we are all feeling that I'm like, oh my gosh,
if my dad wasn't going to listen to this podcast, the stories I would tell, but I will spare him from having to hear any details. But it is such a funny stories though. Like there have been times where I'm calling my best friend on FaceTime and I'm like, well, and she's like, what do you got for me? And I'm like, I don't know how many tampons are. I cannot even explain to you what's happening.
I called my husband because I was like, I'm going to die. Like, I think you need to take me to the hospital. That's I thought it was that bad.
Yeah. Well, this is why I'm glad that you bring up the husbands, because the women or the partners, right? So we women do a better job of talking about their feelings, and we get together for book clubs, or we're at church, or we're doing whatever it is we're doing. And usually we start talking about stuff like this. But we need to be talking to our partners about it, especially the husbands, because when your partner is going through massive hormonal changes, is bleeding till they drop, is not sleeping, and is forgetting stuff, they probably are not the type of partner that you married. And understanding what that person is going through is so important for the relationship, because think like intimacy kind of goes out the window. If you have not slept and you are bleeding till you drop, like, why are you going to want to be intimate with your partner? And that can develop so many other downstream things. I don't want to overstate it, but treatment with hormone replacement therapy like literally saves marriages.
Absolutely.
It really does.
Absolutely.
You see so much divorce, so much prescriptions for antidepressants and
those only hurt. Antidepressants sometimes only hurt that even more because
they can ruin your
sex
sex life. They can ruin your sex life. I mean, I don't want to like bash on antidepressants. I think that there's a time and a place for them. But this whole idea that like we're all going through it together, like the husbands or the partners need to understand. They don't need to mansplain perimenopause to us, but they need to like understand what the signs are so that they can also be ones to be like, I think it's time. Let's get on the internet and find a menopause provider for you.
And give support. I think we just need to feel supported and not crazy.
Not crazy.
The support is everything.
Mm-hmm.
Yeah.
Everything. Mm-hmm. So hormone replacement, like that kind of is like my next question. Yeah. So it is so important. And I kind of was like against it for a really long time because I was like,
oh, really?
No, I
feel like you're always the first to be like, let's try it. Let's do it.
Well, I'm really old, so really no, because I just started. And so if I was really the first one, it'd been like 7 years ago. But I was like, I remember someone telling me like, oh, just a little testosterone and I felt better. And like my libido changed and I'm like, oh God, like who has time for that? I mean, it was probably when my kids were a little bit younger and it was like, who has time for that? Like, I'm not going to take anything that's going to make me want to do it. I'm tired. Like, I don't want, it's kind of like I pushed back a little bit of like, nah, that was like bottom of my list, like of importance. But Austin got me on estrogen, testosterone cream, which,
oh, I didn't know that was a thing.
Yes. And Nicole, actually, one of my best friends, she went to some thing the other day and there was a guy talking about how he didn't think creams worked, but he offers these shots in his office. So this is where we get off going.
This is where we go into snake oil.
Be careful who you're talking to because Nicole called me and she's like, oh, this guy was so great. He was so informative. He was talking about hormones. And she was like, and that the creams don't work. And I said, oh, wait a second. I was like, I'm actually on a cream and my levels tripled being on, and I do half the dose that Austin prescribed. Like I just do 1 pump instead of 2 pumps. And sometimes I remember every day and sometimes
we forget.
Sometimes I forget, which is where I thought I had early onset dementia, but it's getting better. But I said, no, I actually totally disagree with that. And I said, let me guess. He told you that because you can get that from a compounding pharmacy and you can take it and do it at home. Yes. But he wants you to come in his office once a week and get a shot. And he's going to charge you
for the shot.
And she said, yeah.
It makes me crawl.
And so my beg is to women to really think about what somebody's telling you. Like really do your research. Really think about like, not that people don't need to make money doing their job. Right. They absolutely, and these things do cost money. Right. All of this is new and is going to be costly in some way or another. But like, does this person have your best interest or is this person trying to make money? The pellets, I've been a no on those for like forever. I'm not saying they're bad for you. I'm saying I think it was very much a money,
like a salesy thing.
It felt very salesy for a long time. I haven't talked to anybody who does them recently, but it just felt very salesy when there were other options and alternatives that were like, well, this is more convenient for me at home, or X, Y, and Z. But I could go down that road forever. But Austin has me on these few things and it made me feel so much better. I feel like it took a little while. Is it normal for it to take a while to kind of like regulate things out? So you have to be patient, kind of like other meds, like finding the right dose, finding the right medication. Takes a little while to get your body more regulated. But I'm so mad I was so opposed to it for a while because it really is life-changing and it has changed how I respond to my spouse. It has changed even in just like all around how I respond, not just physically, but like how I respond emotionally and mentally. Like my mental capacity feels different.
Yes. And I'm so glad that you are mentioning all of the symptoms that the benefits that you now feel, because we've done a horrible job in medicine by gendering hormones. Like testosterone is for men and estrogen is for women and progesterone is kind of mostly for women too. We produce testosterone from our ovaries and it's converted into estrogen. So, and we have circulating testosterone in our body. It's very normal. So, and then it's not like the testosterone just only goes to like your genitals, right? Yeah. I mean, all of these hormones are mood hormones. GLP, when people get started on GLP and they talk about, oh God, I'm just happy. I have mental clarity. I want to go exercise. GLP, these hormones are working in the mood centers of our brain. And so you hear so much about libido with testosterone and it's for libido. And yes,
I think that's what people just immediately associate it with.
And it can be for libido, but it can also be for just well-being and feeling just more like yourself. And it's not immediate. It's not like estrogen, where if you're estrogen deprived and you get placed on estrogen, you're going to know within 2 weeks whether or not you're feeling better. Testosterone, especially when it's applied topically, it's going to take, I mean, I tell patients 8 weeks before we're really kind of reassessing whether or not you like it or we need to increase the dose and things like that. And as far as pellets, if someone can make a pellet that is affordable and I have some control over the way in which it's absorbed in the body, and I can guarantee my patient that they're not going to go from below sea level to Mount Everest level of testosterone, or whatever it's compounded in, I would be all for it. But what I end up seeing are people that are just like
high highs and low lows. Oh my gosh,
they're so high, and their clitorises have become enlarged. They're like having crazy acne. They're losing hair in certain areas, and a lot of that is
they're growing hair.
They're growing hair in places that they don't want. They're losing hair in places that they don't want. And a lot of it is like irreversible.
Oh, really?
Yeah.
Oh, that's scary.
Wow.
Yeah.
And so I think that's what I've heard with pellets is like people they'll crash and they'll be like, trying to find I need my pellet. I need my pellet. I need my pellet. And I'm like, I don't want anything that makes me feel like that high and that extreme, I guess. Like the consistency.
And you have a sense of control if while applying something daily does require remembering, you at least have a sense of control over like this is the amount that I'm applying. And I think the sense of autonomy and control is a huge part of good midlife care.
Yeah, absolutely. How long can you be on like hormone replacement therapy? Is it forever?
Forever. Okay. It's a forever thing.
And someone who's already, like back to what we were talking about in the beginning, someone who's already been through menopause, it's never too late. Would you say like it's never too late to start?
It's never too late. It's your expectations of how much of a preventative benefit it's going to have on your longevity, I think is up for debate. But there's no better time to feel more like yourself, you know?
Yeah. I feel like
is it ever too like early? Well, I guess if you're not having symptoms, we're talking about symptoms.
Yeah. If you're not having symptoms, I mean, maybe
if you're not having
symptoms.
That's why when people come to see me for their annual exam, I will, as I'm like doing their exam, okay, how are you sleeping? How are you? And I just kind of ask some general perimenopausal type of questions. Right. And if they start saying, oh, it's actually been really bad, or yeah, I really don't want to have sex with my husband anymore. I actually don't want him to touch me. And oh gosh, I just like wake up and I don't even want to exercise. Things like that. Then we usually say, okay, I think we need a totally dedicated visit. You come back and let's do something just to talk about how you're feeling, because insurance isn't going to cover us talking about perimenopause today because you're here for an annual exam.
Yeah.
So why don't you come see me in a couple weeks and we'll try to get it all done in a 15-minute visit.
Which is really hard for you, especially when you're passionate about something and you really want to help somebody.
That's unfortunate.
It's so hard that you can't be paid to do so. Do you know what I mean?
Yeah. Like, oh my gosh, that could be a whole different conversation. Yeah. But that is what is difficult about practicing medicine in an insurance-based world. And it's a struggle. It's literally a struggle every day.
Yeah. Did you have a question?
No, keep going.
Oh, I was going to ask.
I forgot the brain fog.
That brain fog. So she needs an appointment with you.
15 minutes.
Yeah, we're going to actually film Stacy's appointment so you guys can just firsthand.
She signed off on the HIPAA violation.
She did. Just like, these are, I mean, do you hear me? I'm like borderline describing my monthly situation. So, real talk, guys. It's fine.
Table.
It's fine. Nothing's off the table.
It'll come back to me, I'm sure.
Okay, no worries. No, in talking about, a couple of those symptoms, if someone's just like, oh, I don't sleep good at night, but like all the rest, would you say like 3 or 4 of those symptoms, ask your OB-GYN, like how many of the kind of symptoms that we've listed out, period changes, brain fog, anxiety, how many of those before you go, okay, it's time to definitely see your doctor?
I mean, if I have a 39, 40-year-old who comes to see me and is like, I don't know what it is, but I cannot fall asleep anymore. I'm waking up multiple times a night. I just feel like anxious all the time. I'm all of a sudden worried about food allergies for all my children, and I was never worried about that before. God. Like new reasons to become anxious about something. We talk about getting on progesterone.
So progesterone's what helps with sleep.
Progesterone, when taken orally, can be very helpful for sleep. It is progesterone in and of itself is a calming hormone. When we talk about sympathetic and parasympathetic systems in our body, it is helping with that relax, rest part of our nervous system. Estrogen does too, but progesterone can just be wildly helpful for that when taken orally.
Do you always have people take estrogen and progesterone together? Do those work together, or are you fine taking one and not the other?
Yes, this is a great question, and it's very nuanced. So if you have a uterus, at some point in time, you will need to be on progesterone if you are taking estrogen replacement therapy.
Okay.
Because the unopposed estrogen will then confuse the uterine lining, and the lining can build up thinking, oh, I'm getting estrogen. Oh, I'm getting estrogen. I should build up my lining, when really you don't want the lining to build up and become abnormal. So, but when you're in perimenopause and you're still having some cycles, you are producing progesterone. Is it the same amount that you were producing when you were in your 30s? No. So if you're in perimenopause and you come to me, you're still having cycles, but you're having insane hot flashes and night sweats, that is a red flag that you need more estrogen. And you don't necessarily need to immediately get on progesterone as well. So what I like to do often is stack my hormone replacement therapy so that we can add something back and see how you do with it. Okay. So if you came to me and you said, I'm having horrible hot flashes and I'm just like sweating at nighttime, the reason I can't sleep is because I'm having a hot flash in the middle of the night. We can give you some estrogen, see how you do for a couple of months. And if you're feeling great, awesome. Eventually you're going to need to be on progesterone as well, but you don't necessarily have to start them at the same time.
So would someone need progesterone? So for me, remember I called you and I was like, okay, the progesterone, I'm feeling like I'm sleeping better. So like maybe I stay on that. But the estrogen, I was like, I feel like I need to not be on that one right now. So is it normal to start progesterone without estrogen?
Correct. I have patients on only progesterone. I have patients on only estrogen. I have patients on only testosterone. I have some that are on a little bit of all three and 2 out of the 3. But you're on too much estrogen if you are having breast tenderness, feeling kind of moody, feeling kind of bloated, or like just not PMSy, then okay, it's probably a little bit too much estrogen, and we can either not do estrogen at all or back up on the dose.
Okay. It's so interesting.
I'm just baffled at how much that
Stacy's going to have a prescription called in by tomorrow.
So it's interesting, and I was young when this happened, but I did a little bit of hormone therapy actually when I was younger before any of this. And so now looking back, I'm like, it probably wasn't done the right way because I was on estrogen because I had a hard time starting and it was just a whole thing. But looking back, I was like, wow, that was before we know what we know now. And so I know I'm an ideal candidate for, getting balanced. Well, I guess is the way. I guess balance is the good.
But yeah, it is. And I think that going back to even what you said about like marriages, like our relationships with our spouses, like are very, very important. Like they dictate our whole day. Like if it goes south in the morning, it's south the rest of it. Like it's very important. And so when you were saying like a lot of women end up getting divorced, I did hear a statistic that said the highest percentage of divorces that come from women initiating divorces are when they are in perimenopause or menopause. They are they're just done. They are like, and so you have to recognize if women are getting to that point, like what's going on And how do we help them not get to that point? Obviously, like the partner has to step up and be a decent human being.
Takes two to tango.
Some people are happy that they get divorced.
Some people are happy they get a divorce and it's the right thing to do. But I think a lot of times, like having a partner who's understanding and being open and honest with them about what you're going through, and then seeking a little more information about like, oh wait, maybe I can regulate this. Maybe I am feeling a little bit off. Maybe I do need these medications. I think would do wonders for a relationship.
You think about like if someone in the partnership had like a cancer diagnosis, and you would hope that they would come together and support each other to help get that person through a cancer diagnosis. And, you know, perimenopause is not a cancer diagnosis, but it's almost as if we as women need to accept that it is okay to ask for help, and that we're not being vain or needy or crazy for the way that we're feeling, and that it's okay to get that help. The problem is, where do you go to get it? Because we have 80 million people walking this earth that are peri or postmenopause. And I think that the last check we had maybe like 3,000 menopause certified providers.
Wow. I was literally gonna ask like what's the one message you would want someone to take away from this podcast? But I think it would be that to not be afraid to ask for help.
Yes.
To pray that
you can
find someone. Pray that there are more people going into this space that are passionate about it, that care, which I think there will be. I think that this is just the tip of the iceberg.
Well, and half of the reason why we were able to get the black box warning off of estrogen is all of these years of not only researchers and healthcare providers who've been advocating and fighting a long time to get the right studies, to really actually look at the studies and take the black box warning off, and the safety and efficacy of estrogen, but also the women that have stood up and said, this is ridiculous. I need this medication. Yeah. And so I think, I love the Menopause Society. They're a fantastic medical organization. There is a course or an exam that you can take as a provider to become menopause certified, which is on my list of things to do. I haven't really done it yet. And so you can go to their website to see who has been who has taken the course and passed it.
Oh, that's helpful.
Which is helpful, but it's sometimes, Menopause Society, don't read
I was going to say,
watch
the courses,
Yeah. It's buyer beware, because that exam, if someone has passed that exam, that means they're very good at taking a test, and they know a lot of the biomedical science background of the way these hormones act in our body. It is absolutely no way to show whether or not someone knows how to prescribe.
Right. Yeah.
And that's what we need. We need people who know how to prescribe, who know how to listen, who know how to fine tune therapies.
Do you know that's why I haven't done anything, is because I don't like to take medication. I get I'm definitely more granola on that side of I'm just going to let my body do its thing. Well, newsflash, it's probably I do need help. But I just get overwhelmed. So I, talk about fight or flight. I retreat.
Yeah. You're just
and so I just don't do anything.
Yeah.
So, which is not the answer.
It's the wind. That's the easiest. The wind. It's the easiest.
It's just the altitude.
Use that now.
The altitude. Well, we can
it's my moon sign.
But I think that it is so overwhelming that for those who might be like myself, I just don't do anything.
Yeah.
And and then life's too busy, and I'm like, it's fine till it's not, right? And that's what now even these conversations where I'm like, I am absolutely a candidate for this, and I want to make sure that I know my body well and that I'm taking care of it. But I think that I just get so nervous to take medication that if it's not someone I trust, it's just hard, and I don't know where to start, so I've just done nothing. And I bet that there's a lot of women that are in that same boat that just don't know where to start. So we just don't do anything.
Well, and that's what this is for. So hopefully if you're listening and you have had any of these feelings or you're struggling in this area, hopefully this is a little bit helpful.
One, you're not alone.
Helpful for me. You're not alone.
You're not alone.
All three of us sitting here.
Yeah,
living in the same space. I for sure am, because I'm the grandma of the group, but always.
Come on.
But we'll have Austin back on, because I feel like there's so much more that we could touch on, but trying to keep these episodes where they're not 7 hours long, because I feel like we could sit here for a really long time.
Everyone keeps driving in their car to listen.
But two, we would love, like if y'all have questions, like message us on Instagram. Email us, send us questions that you have that we can then shoot over to Austin, and she can answer those next time that we have her on, which would be so great.
Yeah,
so.
We want to help be a resource of this.
Or come see me. You can
or come see me
if you're in the Dallas area.
Do you do virtual consultations?
I do virtuals.
Okay, perfect. So if you're in Prosper, Frisco, or McKinney and you don't want to drive to Dallas, but we'll list her info and everything under this episode, her contact information, and then send us questions. If this was helpful, gosh, we hope it was. If you want to share it with your girlfriends, I'm pretty sure no guys are listening to this episode. But
honestly, halfway through, when we were talking about this, I hope partners and spouses listen to this.
My husband will listen.
Yeah, because honestly, I'm like, this would be so. If I was on the other side of it, I'd want to know like what is going on and how can I help.
Yeah, I don't know that a lot so much thinking that, Stacy, but I love you.
There's so much more to like. We just scratched the surface. Like, there's the whole sexual health side, and
it really does benefit you guys to like pay attention.
You said this helps sex life, so
I know
it does for sure. So.
And their egos, like the poor guys. If we don't want to have sex with them, then they start spiraling.
It's a struggle.
They think there's something wrong with them. Yeah. It's not about them.
Hayden, poor guy, is literally here for every girl episode, and I'm like, you know what? His girlfriend is gonna be like, thank you guys so much for teaching us.
So knowledgeable.
Yeah.
So, she's actually paying attention.
Exactly. Well, thank you for coming on, Austin.
Thank you
so much.
So fun.
We will definitely have part 2, 3,
yes,
4, 5.
hopefully it's just the beginning.
Just the beginning. Thank you guys for tuning in. Like, if you can, give us a review. Subscribe to our podcast. We appreciate any feedback at all. So you guys have a great day.
Thanks.